Almost all set. Hi everyone, good afternoon. Welcome to our Erie County COVID-19 update for February 23rd. Pleased to be joined by Dr. Gail Burstein, who you'll hear from shortly, as well as Karen Gambino from Deaf Access Services, who will be providing the American Sign Language. As an update, there are now 63,100 unique confirmed COVID-19 cases since February 21st, or through February 21st in Erie County. That is all confirmed cases, including those who've recovered and unfortunately those who've died. The 7-day positivity rate continues to reduce. It's now 4.2%, effective as of that date. The hospitalizations on the 21st were 245 COVID-19 patients in Western New York hospitals, of which 55 of them were in the ICU, and 213 patients in Erie County hospitals, which 50 of them were in the ICU, 38 were on an airway assist. Unfortunately, 5 more individuals died. We'll talk a little bit more about that. And 38% of patients were age 64 and under. Looking at the testing results from the last 6 weeks, you will continue to see the drop in the positivity rate. While our overall tests have gone down, the confirmed cases, of course, have gone down as well. And the positivity rate is now the lowest it's been in quite some time, actually since the beginning of November. And the weekly positivity rate is the lowest since October of 2020. So we've gotten through the fall and winter, and we are headed in the right direction when it comes to the positivity rates and overall cases, and that's down. New COVID cases by zip code for the week ending February 20th, not easy to read, but these are all cases 20 and above. And the highest is West Seneca. West Seneca's had, in some ways, the last few weeks, some of the highest cases. It also has the highest positivity rate at 6.4%, and the highest, or one of the highest, daily average cases on a per 100,000 population. So West Seneca and Hamburg, unfortunately, are 1 and 2, as you have been a lot lately. Orchard Park is now 3rd. As you will note, that most of the positivity rates here are in the 3 or 4 category. There are some in the 5s and a few in the 6s. We want to see those continue to drop, and we've had some trouble communities, there's the best way to put it, that have continually had the highest cases, and that's sad because those are individuals who are getting sick, and there are people from those communities who are dying. And I don't have any personal close friends who've lost from COVID, but I know people who've lost personal close friends and family from these communities. So we need to be better. Hospitalizations, February 8th through February 21st, you continue to see the line graph going down for overall cases, though the actual ICUs have not dropped tremendously. So we have seen a nice decrease in the overall hospitalized COVID-19 patients. Approximately 23% of COVID hospitalizations are those in the ICU. And of course, if you're in the ICU, that means you're very sick. And 38% of all COVID-19 patient hospitalizations are under the age of 65. So we're not talking about just old people who are getting sick. And you see the lowest line on the graph, and that is unfortunately deaths. And we have continued to see deaths pretty much every day for the last few months. And I'm hoping soon we get to a point where we just have 0 deaths. But we're not at that point yet. And this chart, which shows the mortality data from the beginning of the pandemic in March of last year to now, so we're really getting 12 months worth of data. And you continue to see that there are still people dying in Erie County from COVID-19, and they're not all seniors. There's now been 1,635 total deaths as a result of COVID-19 in Erie County. And 94 of those individuals had died in February through our data, which is as of February 18th. And unfortunately, as we look at the data, more people have died under the age of 60 from COVID-19 since November, so November, December, January, and this part of February, than during the first 8 months of the pandemic. And I think we hopefully would have learned after the first months of the pandemic how dangerous it could be, including for younger people. But just in the month of February alone, There are 2 people who've died under the age of 40. 3 have died between the ages of 40 and 49, and 8 who've died between the ages of 50 to 59. And very similar numbers for January. Actually, at the trend we're going at, we'll probably have more people die in February under the age of 60 than we had in January. And this is really sad because these are all in all likelihood preventable. So I want people to understand they need to take this seriously. There's still folks out there who are not. And I know people are over the pandemic, but the pandemic's not over. We need to vaccinate everyone. We need everyone to take this seriously, wear a mask, wash your hands. I've been washing my hands so much, and basically they're dry as can be. We want people to understand that we're not out of the woods yet. While the numbers are going down, as in new cases, as well as deaths, it's still sad when we see individuals die that could have been prevented. So I would just, once again, I don't know how many times I've said this since the pandemic started, please take this seriously. This is preventable. If you do the right things, you can prevent illness, and we're hoping that you do that so we do not have to add to these totals. But unfortunately, we will have additional numbers to add, which are not just numbers. They're names, their parents, their children. I was reading a report earlier today about a mother's group of those who've lost their husbands who all have young children. And these are individuals primarily under the age of 40. And it's just sad reading that the snuffing out of a life so young. And now these mothers have these young children they have to take care of as their husbands have died. So we just need to do a better job of ensuring that we can keep these numbers as low as possible. And that's by protecting ourselves and others by wearing the masks, washing our hands, practicing safe social distancing when you need to, and doing our best to prevent the future spread of coronavirus. Now, talk a little bit about vaccine updates, and then I'll turn it over to Dr. Burstein and talk a lot more about vaccines. But through the 22nd, the Department of Health has administered 22,468 first doses and 17,036 second doses. We're starting to see, based on what we're expecting next week, to get more supply. So we'll be able to finish all the January appointments. We'll be able to continue to work on essential workers and complete the task that's been assigned to us by New York State to vaccinate those that are in developmentally disabled congregate settings. So that's a good sign. Also a good sign is that through actually today's report, which came out around 11 o'clock today, the 23rd, New York State reports from all sources. So this is county clinics, state clinics, pharmacies, health centers, hospitals, the federal programs, including nursing homes and adult care facilities and the VA, that 13.5% of Erie County residents, or 124,127 of our fellow neighbors, have received at least the first dose. And 8.3% of Erie County residents, or 76,396, have received the full vaccine doses. Right now it's 2 doses, but very soon we believe Johnson & Johnson will get their dose approved, and that's a 1-dose vaccination. So as slow as the process has been, as disappointing as the process has been, and trust me, I know it's slow, I know it's disappointing. I have not gotten my first dose yet because I'm still waiting. 124,000 of our fellow Erie County residents, or approximately 13.5%, have received their first dose, and 8.3% of our fellow Erie County residents have received their full vaccination. That's good. It's going to get better soon because we know the numbers are going to increase just because we are expecting in the upcoming weeks doses that we'll get them, and we'll get a little bit more than we have received in the past weeks. Now, I'm talking about nursing homes. New York State provides on a biweekly basis to Erie County updates on nursing home and adult care facility vaccinations as reported to them by the federal government. So we have the latest statistics, and what's very good to see is almost all nursing home residents have received both doses of the vaccine. And the vaccine appears to be working because we're seeing a dramatic drop in the last week or so with new cases and deaths of nursing home residents. I can confirm that the last 2 days, we did not have a death in the reports that I had seen of an individual from a nursing home, either in a nursing home or in a hospital that was a nursing home resident. So it's good to know that it appears the vaccine is working. If there's one area of concern with regards to this reports, and you see the numbers on the screen, it is the declined staff numbers. We're a little concerned about the number of staff members as a percentage who've declined receiving the doses. For example, in nursing homes, 311 have received only the first dose. 3,611 have received both doses, but 2,812 have declined the doses. That's roughly about 41%. In adult care facilities, it's very similar. First dose for adult care facilities, less than 300, 952 both doses, but 944 adult care facility staff have declined it. So I'm glad to see that the patients are primarily getting the doses, and it seems to be working because cases are dropping and deaths are dropping as a result of it. But I am concerned about the staff because, of course, a staff member who's not vaccinated could bring it in, and if there's a new resident who hasn't been vaccinated or another employee there who hasn't been vaccinated, it could be transferred. So that is a concern, and that's why we continue to request everyone, please get vaccinated. And with that, I'll turn it over to Dr. Burstein to talk about our vaccine doses that we have received, which were delayed a number of days because of the storms in the Midwest and Texas, but we just got them. So Dr. Burstein.
Thank you. Good afternoon. So as the county executive mentioned, we're excited that we received 5,300 vaccine doses that we were supposed to have received last week. However, better late than never. So 1,600 of those we are going to transfer to the hospitals for them to give to their patients that have the highest level of comorbidities, making sure that they're all protected because they would become very, very ill if they were infected with COVID-19. Also, we have 1,700 doses for first doses for our Erie County Health Department pods, where we are vaccinating the Phase 1B group, so these essential workers that were identified by the New York State Health Department, also people that do a lot of front-facing work, like people that not only that work as first responders, but also people that work in grocery stores or restaurants or taxi drivers. We also, teachers, we also have 1,700 second doses to finish people off, making sure they're fully protected. And then we also have 300 doses for our developmentally disabled who live in congregate living settings, so making sure that they're protected. So, as you know, we in January, we did have to cancel some appointments. So we are getting through rescheduling those appointments. Right now, we are rescheduling people who had canceled appointments between January 27th and January 30th. So that is the end of the month. We are almost there. So please, if you had a canceled appointment during those days, please check your email, making sure that, checking for an email from us so you'll be able to reschedule. For people who had earlier appointments in January that don't recall seeing an email from us, please check your junk or your spam folders. We have sent out emails to everybody, and we will send you instructions if you contact us. So please look for those emails and respond to it if you still want a vaccine for us. And also, we are excited. We think we're going to be able to finish up our those canceled appointments this week, and next week we will be able to start scheduling for our essential worker population in the community that we haven't already canceled. So this will be new appointments that have not been canceled. So it'll be new people that will be able to get vaccinated. We're hoping next week. So there is going to be, as you've heard, a pop-up clinic at the Delavan-Grider Center, and I will let do you want to talk about that, or you want me to talk about that? I don't see any spritzer.
We got the special hand sanitizer. That's all right.
Okay.
I think I threw the doctor a curveball. As you all probably know, there is a special pop-up clinic that New York State is doing with FEMA starting March 3rd at the Delavan-Grider Community Center in the east side of Buffalo. You can sign up starting tomorrow at 8 a.m. if you are in one of either the 1A or 1B category and you live in one of the following 10 zip codes: 14201, 14204, 14208, 14209, 14211, 14212, 14213, 14214, 14215, and 14222. Took those a little slower so Karen could catch up. But it's our understanding that for the first 2 weeks of sign up, it is only going to be limited to individuals in those zip codes, and then they're going to revisit at the end of the second week how the appointments are, and they may open up additional the next 2 weeks for the entire region. But as of right now, we're understanding they're going to receive 1,000 doses a day for basically a month's worth of clinics. So if you live in one of those zip codes and you are in the 1A or 1B category, starting at 8 o'clock tomorrow, you can sign up either at the Am I Eligible New York State website, which is on the screen, or you can call the New York State appointment hotline at 1-833-697-4829. Please do not call the Erie County Department of Health. We will not be scheduling appointments. We do not have access to the appointment schedule for this location. It is a special site that the federal government is bringing in here through FEMA, the Federal Emergency Management Agency, working with New York State. So New York State will be scheduling the sites, but the federal government will actually be running the sites. So please do not call the Erie County Department of Health. I know there was some false information that was spread over the weekend by a community leader who said, call Erie County, they're scheduling. Do not call Erie County. You will not get an appointment at the pop-up site if you call Erie County. Call the 1-800 hotline or go to Am I Eligible website, and if you live in one of those zip codes, you will be able to schedule it. If you try to schedule an appointment during the first 2 weeks and do not live in that zip code, and you are not able to provide evidence like a driver's license indicating you live in that zip code, you will be turned away. So I'm sorry to those who wish they would be able to get an appointment at this site who may live outside their zip codes. The reason this site is being put there by the state and the federal government is because the percentage of individuals of color who have received the vaccine in Erie County is much less than what the actual percentage of communities of color are in Erie County. It's actually exceptionally low, and it's disappointing to see. So the federal government and the state have joined together for this pop-up clinic to try to alleviate that, to give individuals who want a vaccine, who live in these areas of concern, an opportunity to get it. And with that, I'll turn it back to the doc to talk about schools.
Thank you. Switch her on. So I just want to talk about let everybody know that we're still seeing a lot of cases of COVID-19 in our schools. So this is looking at the number of average number of cases of COVID-19 per day that are reported to us in the New York State, from the New York State Health Department, of people who either work in schools or are students. So you can see that in the fall, we had a relatively manageable number. October, we only had about 5 a day. November, we only had about it raised to 23 a day, but like all winter, we've had a large number of cases, over 30 a day, and schools again are generally safe places. However, there is still infection with COVID-19 in the schools, and we still have to keep up our strong preventive policies to make sure that that does not spread in the classroom, and that schools can stay open and they can remain safe places for the students, for our children, our most precious assets, and for the staff. So this is a graph looking at the number of cases that have been reported to the Erie County Health Department by week of either students or staff who are in school. So you can see again, if we look at in the winter, December, January, February, we've had a significant number of cases each of those months. And so we really need to keep our foot on the gas and make sure that we continue with our preventive measures. So just talking about youth sports, so we are also following sports teams and making sure that everybody stays safe and healthy in our youth sports. So as you recall, the New York State Health Department put out some guidance that teams that are categorized as high and medium risk for transmission of COVID-19 can be able to start participating again, playing in games and tournaments with certain preventive limitations. So since we've started working with the teams to track the data of people who've been positive, and we're placing all teams with at least one case on pause for 10 days, just to make sure that infection does not spread during that time period. And then we're also doing contact tracing and identifying close contacts on the team and putting them in quarantine and really encouraging them to get tested. So, so far, since we started doing this in the beginning of February, we've put 49 teams on a 10-day pause. Either because the athletes were infected or the coaches were infected. Right now, we have 21 teams that are currently on pause. I just want to let you know that of all the teams that have been on pause, of all the 49 teams, about half, 25, have been hockey teams. So we know that for biological reasons, the environment of the hockey is really conducive to transmitting infection because the air is very dry, and so the aerosols will stay in the air. They'll stay suspended in the air and actually travel farther because of all the cold, dry air. The COVID likes cold, dry air. So also, many people that play hockey are using the locker rooms, and we know that the locker rooms are a place where you can see high transmission. People are close together for a long period of time. Oftentimes when people are getting dressed and undressed, not wearing a mask, so we're seeing a lot of transmission, we think, from people using the locker room. So please, if you're playing any type of sport, please try to figure it out so you don't have to use the locker rooms. Also, we are meeting with representatives from certain hockey teams with their coaches this evening, and I just want to say that the county executive is going to be on that call, so making sure that we all understand what the rules are and we're all working together to keep everybody on the team healthy. So just want to remind everybody that the Erie County Health Department is still offering free diagnostic tests for COVID-19. We think it's really important that even though our numbers are decreasing, that people still know their status. We are still seeing many cases in Erie County, and we want to make sure that people are identified, put in isolation, and close contacts are identified, they go in quarantine, and that's how we break the chain of transmission. So if you want to know your status from the Erie County Health Department, you can call 716-858-2929. So for any Erie County residents that wants to get tested for any reason, they can get a PCR test, or some places that require testing refer to that as a molecular test. And those results are available between 1 to 3 business days, or you can get a point of care, or which is also called a rapid test. And of course, those results are available to you, within a half hour of the specimen collection on the site. So the Erie County Health Department is still offering free testing for any Erie County resident who wants to know their status. So I'm going to turn it over to the county executive to finish up with police reform.
Thank you, Doctor. Today, the draft report of the Erie County Police Reform and Reinvention Task Force's recommendations was released. We just received it this morning. It was approved by the task force, I believe, yesterday, and it is voluminous. There are dozens of recommendations, and the entire report is 233 pages when you include all the appendices. The public has a week to comment on it. And then after that, it has to be sent to the legislature, and the legislature has until April 1st to approve changes or reject the report in full. So we want the public to understand when it comes to the Erie County Police Reform and Reinvention Task Force, the task force has issued its draft recommendations. I want to thank the task force. They've worked very hard for the last 4 or 5 months or so working on this project. So Chairman Marty Floss and others, I thank you for all your good work, and it is a very comprehensive analysis and review. As I said, the public has until March 1st to offer comments. You can read the report and comment on it at the website you see on the bottom of the screen. So if you have any questions, go to that site, and we will hopefully, you'll be able to read the report, you'll be able to comment on it as you see fit, and within approximately a week, comments will be accepted, and the final report will be issued by the task force, at which time it will go to the legislature. And one more thing, I want to bring up our Director for the Office of People with Disabilities, Frank Camerata. You've seen him in the past, it's been a while, but we have a special proclamation. And so, Frank, if you could come up. Come right up here. Put my mask on. Want to let the public know what's going on?
Okay. Get the mask off, thank you. Thank you, County Executive. Just on behalf, actually, of Deaf Access Services, the County Executive has been awarded the Community Partner Award for all the wonderful work that you've done in enabling the ASL interpreter, for all of your press briefings, and so they just wanted to say thank you. Here is their
Thank you.
note, and
Wow.
there is the wonderful award that they're
That's pretty.
providing you. So I just, on behalf of them, I'd like to also say thank you for doing this as well. So it's
thank
as you
you.
know, it's very important that we're an inclusive community, and that we're providing ASL interpreters so that everyone in our community understands what is going on, especially during this very difficult time. Thank you.
Thank you, Frank. And first off, thank you to Deaf Access Services for the award, but more importantly, the work that you do in the community with Karen today and Kendra, of course. We certainly want all the members of our community to be able to know what's going on, especially in this very difficult pandemic. So thank you to Deaf Access Services for the award. There's a neat little look at what it is. And on behalf of the people of Erie County, I'm proud to accept it. Thank you, Frank, for coming with the award, and to our friends at Deaf Access Services, not only for the award, but the great work that you do. So thank you. Appreciate it. And with that, we'll take some questions. So let's open up the phone lines. And we will start with WIVB-TV, George Rickard. George, are you there?
Hi, Mark. Regarding weddings, the state came out with some more specific guidelines for weddings, and one of the things is that the venue has to notify their local Erie County Health Department before the wedding. So my question is, how would a venue notify the county health department? Would they have to wait for approval or just notify? And then thirdly, how does the health department, or will the health department, try to enforce wedding compliance?
I'll turn this over to Dr. Burstein, because the health department, as you note, is the primary receiver of this information, and actually she has more information than I do.
Thank you. Hi, George. So the New York State Health Department did come out with a little bit more information about what to expect when you're expecting a wedding. And so we will expect the local health department, Erie County Health Department, we will expect to receive notification from the wedding venue, the site that is going to be hosting the event, and we'll want to review their safety plan, making sure that they have all the requirements that will be in the required by the New York State Health Department in their plan. We're still waiting for more details about what exactly needs to be in that plan. And again, the local health department is the enforcement arm here, and we also know that the Erie County Health Department we don't want to close up a wedding. I want people to celebrate, and we want people to celebrate safely. So if the venue doesn't quite meet the criteria for the wedding, we will work with that venue to make sure that they make the appropriate changes so that everybody will be able to celebrate and make sure that they're safe. So again, we are waiting for specifics. We can't enforce a policy if we don't have the policy yet. So we are still in that holding pattern. Thanks.
Okay, next question to WGRZ TV, Kelly Dudzik.
Hi, so I'm getting a lot of questions from people about how to make vaccine appointments, and somebody emailed me today thinking that the convention center clinic was opening tomorrow. So just so people aren't confused, if you can explain to people what you know about that situation, and I know that the details aren't out yet, and then kind of go over the Delavan-Grider information. Just it's not just that you have to live in that zip code, you also have to qualify for 1A or 1B already to be able to make an appointment tomorrow morning for that one, right?
Yep, you're correct on both. The convention center is not open. I heard there was some false information that was shared about both the convention center and the Delavan-Grider site this past weekend. If you see it from a friend on social media, if Aunt Ginny posted, it might not be right. Bringing back Aunt Ginny. Trust the sources, New York State, the Erie County Department of Health. Don't trust what your friend said or what you heard on a radio program, something like that, because what we're finding out is a lot of people are sharing false information. There was an individual who was berating me on social media for something that was absolutely false, and to which I responded, I'm sorry, you're incorrect, it's false, here's the truth information, please don't share false information. And of course, I didn't get an apology, but that's how it goes. So the Delavan-Grider site is not opening until March 3rd, but you can make an appointment through the New York State site starting tomorrow at 8 a.m. if you live in one of 10 zip codes and you qualify in the 1A or 1B category. If you do not qualify, regardless of where you live, you cannot get an appointment. And when it comes to the convention center, there's no date set for the convention center yet. That is when mass doses will be available, 3,000 or more a day. And I can tell you right now, when it comes to Erie County's allocation, we're getting like 3,000 for the whole week right now. So we're not going to be opening up the convention center until we get enough doses to basically have 20,000 plus doses for the county, so that we can do it as a mass site. We are talking with New York State about the logistics associated with it, but if anybody thinks that the convention center site is open, they can go knock on the door. They won't find anybody there because the place is closed. And do not call the Department of Health for an appointment for the convention center because we do not even have an opening date yet. Please follow accurate sites, the Erie County Department of Health, the New York State Department of Health. Those are the sites that have actual information on what is open and how to get an appointment. Aunt Ginny might have heard it from her neighbor, but her neighbor may not have been accurate. So sorry, Aunt Ginny. Trust the departments of health. Channel 7, WKBW, anyone on?
Yes, this is Hannah Bueller. The governor announced 2 cases of the UK variant here in Erie County. I was wondering if Dr. Burstein, if you could elaborate on that.
Sure. I'm going to get the doc. Just to know, we assumed it was going to be here. It's just a matter of when they actually found it.
All right, thank you. Yes, so we were also notified that there were 2 individuals that had the B117, the UK variant strain, that were Erie County residents. Those specimens were collected at the end of January, and the state has, subsequently run the genetic sequencing and identified those variant strains. So those persons, they have, completed their isolation. The contact tracing has been completed. We put all their close contacts in quarantine, and so far, we've not been informed that there have been any other variant strains. So there's just 2 individuals with right now. Because it's a more easily transmittable strain, it's a more aggressive strain. Until we see more people in the community that are immunized, we're going to expect to see more of these cases. So this is really considered as just the beginning of more variant strains that are identified in Erie County and throughout New York State and throughout the rest of the United States. That's why it's really important that we vaccinate as quickly as possible. Thanks.
Spectrum News.
Hey, Mark, it's Andy Young. This one relates also to that UK variant strain. Does that change how the county approaches this in any sort of way? Any extra cost for concern? And how do those vaccines line up with preventing and being effective against those strains?
Well, it's my understanding the vaccines do line up with prevention. The South African variant was a little concerned with the vaccines, but the British one, it seems to have full protection. And when it comes to where we are, knowing that the variants in our region, as I said, we've assumed it was here no matter what. There was a case out of Niagara County. It is something we have to track. If we started to see a rise in cases and the variant is the reason, then it would affect a number of actions that would have to be taken, including youth sports, including weddings and the like. So thankfully our numbers are going down. That's where the direction we want to continue to see it. Until we can vaccinate the entire public, we still need to be wearing masks, and then we might even need to wear masks for a while after everyone's vaccinated, because we know a certain portion of the population is not wearing masks and is not vaccinating. So we are just reminding everybody that the danger is still out there, and all you got to look at is the individuals who've died in February. We've had, I said 13 individuals die under the age of 60 just in the month of February alone. And we'll probably have more people under the age of 60 die in February than we had in January, and that really shouldn't have happened. But it's happening because people aren't masking, they're not taking precautions, and they're putting themselves and others at risk. So whether it's the variant or just plain old regular coronavirus, COVID-19, it can kill you. And we just want everyone to act appropriately so that no matter which one it's out there, you're protected from it. WBFO, is anybody on? If not, WBEN.
Hey, Mark, it's Mike Baggerman. Can you hear me?
Yes, go ahead, Mike.
So this question is related to the New York State vaccine sites that, of course, UB South, people have been trying to get appointments there, but they can't get it. So they decided to try to book something somewhere else. During your news conference today, I looked at some of the sites, and you can get one up in Potsdam, but you would have to wait until April in order to do it. I'm just curious what you would have to say to any Erie County resident that would think about trying to travel out of the area to get a vaccine, even though it's far away. Should they wait to do it? With the possibility that more vaccines would be coming locally? Would just love to get your thoughts on that.
Well, actually, I know some people who've traveled very far for the vaccine, including Potsdam. I can't tell a person what to do. If they're more at risk, especially with comorbidities or their job, then they should get the vaccine as quickly as they can. I do know that there were approximately 3,500 doses, first doses, that were allocated for the UB South Clinic for the upcoming week, but those are for appointments that are already booked. It's my understanding the UB South Clinic is booked all the way through April. Will there be more vaccines available in March and April? Yes. Yes, to the point where, as Dr. Burstein noted, we hope that as early as next week we can start scheduling some new first dose clinics for essential workers. But I can't be the one to say whether or not somebody should travel. If they are a high risk and they could do it safely traveling, then it might make sense. Potsdam is a beautiful area of our state, right up on the St. Lawrence. It's a little colder there now and get a lot more snow. But if you feel that it's an okay trip, it would probably make sense to go over 2 days, get there like the night before, stay overnight, get your vaccine, and drive back. I know a few people have done that. I hope by the time we're having this conversation a month from now, it's totally changed, and we do have thousands and thousands of more vaccines that are available and more dose clinics that are open. But until such time, we've got to deal with play with the cards that we're dealt with.
A quick follow-up to that. Does this signal that other communities are getting a greater allocation of the vaccine than Western New York? Potsdam has been Potsdam, Syracuse, Binghamton, those have been places that have been getting the vaccine appointments still out there, but yet UB South, like you had mentioned, it's booked all the way through April. Are these communities getting more than Erie County?
No, they're not getting more than Erie County. What's happening is they have everything's distributed by the percentage of their population. And what I've also been told is in some of these areas, the population is declining it at a higher rate than what we would be doing in other areas. So if they're giving population, or they're distributing it based on population, and half of their population doesn't want to get vaccinated, then there's still a lot of vaccine available. The Rochester clinic, my understanding is they were booked at lower numbers than the UB South clinic. So they only had, like what I was told was like 1,500 to 2,000 appointments scheduled in a week, as compared to the UB clinic, which had 3,500. And when they realized they could up the number of doses on a weekly basis, they increased the number of appointments. So more appointments became available at the New York State site, at the Dome in Monroe County. This is not a county issue. It's not a Monroe County site. It's not a site, I think it's St. Lawrence County where Potsdam is. These are state-run sites. And so anybody who lives in New York State can qualify if you're willing to drive. But the distribution is based on population. If the population is declining it at a higher rate than another area, then that just means there's going to be more vaccine available. And truthfully, I don't know how many people are willing to drive to Potsdam. That's a long drive. And in the winter, it can be a tough drive too. You better have four-wheel drive, and you better have that backpack in your vehicle in case you hit a storm, because if you're driving up by Watertown in the Tug Hill Plateau, it can get really bad. Lots of snow very quickly. So it's not an easy drive in the winter. So perhaps that's one of the reasons why some people aren't taking advantage of it. Sandra Tan, the Buffalo News.
Hi, thank you. Do you know when Erie County will be getting more than just an incremental increase in the vaccine to the point where actually opening up the convention center might be a realistic possibility? I know you said March or April. I don't know if you've received any more information from the state or federal government that's more specific than that. Also, has the state given the county the green light and said, yes, if we do open a mass vaccination site, the convention center is going to be where it's at?
The answer to both questions is no. We're actually having a conference call with the state later today on the convention center site. But we have not received any indication on when we'd be at a position to have the mass vaccinations site available. We were told to begin preparations. I'm hopeful it'll be open in March. If the dose numbers aren't high enough to justify opening the convention center, it won't open in March. But that is out of our control. I would suggest that it's better to kind of keep track of what the federal government's disbursements are, because it's the federal government that is dispersing more doses out. And you are right, the increases we have not been huge. They've been incremental. But we've been told there is going to be a point fairly soon, whether it's March or April, in which we're not talking potentially about 3,000 doses coming in total for the county, but 30,000. And so we've got to be prepared, because we just can't cut on a dime like that and handle that overnight. And that's why we jumped forward to offer the site, and we're talking with the state about it later today. Anyone else? If not,
I have another question.
we'll start at the top. We'll start at the top, and we'll go one more round. George Rickard, Channel 4, any more questions?
Yeah, Mark, you had mentioned that tonight you're going to be on a conference call with hockey coaches around the area. Is part of that discussion going to be talking about Section 6's decision to allow 2 fans per player? And whether that is part of the discussion or not, how do you feel about that decision of Section 6 to now opt in to allowing fans even in hockey games?
The county had already said that was okay, but it was up to the associations to make a determination of it. So Section 6 is allowing what we basically allowed about a month ago, 2 fans spread out, a larger facility, not a big problem. I'm not too worried about that. What we are worried about is what we've seen, which is increase in the number of teams that have to be put on pause because a player or coach is testing positive, and also some of the negative reaction we've had from some in the sporting community who just seem to think that this is a joke. And it's not a joke when a player or coach gets sick. So all I gotta do is look at what happened to the Buffalo Sabres. Rasmus Ristolainen's career might be at risk, and he was probably in the best shape of any Sabre player. 26 years old, that's the prime for a defenseman, and playing his best hockey of his career, came down with a horrible case of COVID, and is still out, and they have no idea of when he's going to return because of the impact on his body. So for any coaches or families out there saying, oh, my kid's an athlete, they're strong, look at Ristolainen and hope that your child never gets what he did, because he got a really bad case of COVID-19. And as has previously been announced by a number of the other Sabres, they caught the virus and they were sick. They just weren't asymptomatic. There were only, I think, of the number that were identified as having been positive, and they've self-identified as being positive since they've come back. Only one of them, I believe, was asymptomatic. The rest of them had some symptoms, and some of them were not good, and of course Ristolainen was really bad. So we want to remind the coaches and the associations what the rules are, because we're having some issues, and it seems to be associated primarily with hockey, which, as the doctor noted, there's probably a scientific reason why, just because of the cold facilities and the tight quarters with locker rooms. Different than, say, some of the other teams, though basketball certainly has a number of teams on pause. And I've actually spoken to Joe Botto, the head of the New York State Hockey Association, with regards to this, and we're actually going to have a separate call with the New York State Hockey Association regarding hockey matters, because we're all worried. We do not want to have to shut down these sports after allowing the competitions to start again. But if we see cross-ice transmission, if we see cross-game transmission, and teams not taking it seriously, then we are going to have to put some strong regulations in place or shut down the leagues again, and we do not want to do that. Channel 2, Kelly Dudzig.
Have you had any issues recently with places where people are congregating, violating the rules, like restaurants or anything? Just kind of update us on that situation since the orange zone has gone away.
Well, we always get reports, and I'm sure we've received some major reports, but I don't think we have any. We haven't issued any violations. The doc is saying no. We always get information, and they'll research it, but as of right now, we haven't shut anybody down recently. Channel 7. Any more questions?
Yeah, can you talk? Yep. Can you talk about the reopening rather, of stadiums and large arenas? The venues are supposed to submit plans to the health department. Have you seen any plans from any local venues thus far?
No, we've had conversations. Remember, there's a 10% threshold for, at this point, only sports stadiums over 10,000. There are, it sounds like, going to be other plans coming forward, but as of right now, we haven't received anything. And I have, and others have had talks with the Sabres. I think they're still trying to determine whether it makes economic sense to do it. If they've only got a little less than 2,000 people in the arena, does it make sense to open it up for 2,000 people? And then there's requirements with regards to testing that have to be met. That are not as easily attainable when you have multiple games per week than if you had the football game and you had one game per week. So those discussions are still ongoing, but I think it would be best directed to the Sabres as to whether or not they plan on opening up at this point. Spectrum News? If not, WBEN, Michael, any more questions?
Yes. Do you anticipate Erie County administering the vaccine to people with comorbidities now that you're essentially caught up with all those canceled appointments, or is it still going to be the hospitals for the foreseeable future?
Well, for the next week, the distribution is going to the hospitals. After that, we'll revisit it on a weekly basis after conversations with the hospitals themselves. I think it's fair to say some hospitals would love more doses for their population. Others might say we're okay at this point. So this first week, which really should have been last week, We just got the doses in, but they were delayed. We expected to receive them last week, but of course they were delayed because of the weather in Texas and elsewhere. That is the first week of comorbidity, our receipt of those doses. So those will be going to the hospitals, and then we'll talk with the hospitals and revisit it on a week-by-week basis. And if we are at a position where we can open up additional clinics for those with comorbidities, then we would open up those clinics and let the public know about it. Final question, Sandy?
Thanks, but I have nothing further.
Okay. With that, I want to thank you all for tuning in to today's report. I believe we're going to have a report on opiate tomorrow. Tomorrow, we're going to be having a special press conference with regards to the 2020 numbers on opiate use as well as overdoses, including what, as I said before, is definitely a trend that we don't like seeing. The number of individuals who are using cocaine that is spiked with fentanyl and dying from it. They think they're just snorting cocaine. It's not the case. In a lot of people, we find many drugs in their system. And also the racial breakdown, the ages, it's concerning because we're seeing a lot more older people dying of overdoses, more peoples of color dying of overdoses. So we have some very significant concerns, and we'll talk about those separately tomorrow. And with that, I want to thank Karen Gambino for her continued good work in providing American Sign Language to Deaf Access Services. Thank you for the award. I very much appreciate it. You've been a great partner with us during this past year, and I thank you. To Dr. Gail Burstein for your good work, always thank you. And Frank Camerata, you don't see Frank a lot, but Frank's actually part of our vaccine task force, and he's been working very hard with congregate communities associated with the developmentally disabled and other disability type communities. And one of the communities that we've been working behind the scenes vaccinating are those in congregate settings, and Frank's been instrumental in that. So thank you, Frank, for your good work. To all, be safe and well until next time, and wear your masks. Take care.